My experience has been every great man or woman I've known had a passion to make the world a better place. Every organization that I've ever seen I consider great had such a person leading it.
The goal of Children's, the mission of Children's, is the ability to serve any child, regardless of their ability to pay, and provide the best medical care that exists today. That's it in a nutshell.
And that starts here. Then it can go to the clinicians and the doctors and the programs, all the facilities, everything that goes with it. This is a very complicated business.
I mean, it's sometimes daunting, you know? We sort of kind of forget the things that we do on a day-to-day is a pretty huge impact.
I was on the search committee that hired Chris. There was just something special about him. You sense a degree of confidence in him, and sometimes I'm not sure where he's going or where they're going, but wherever they're going, I want to go with them.
Today, a group of young patients broke ground on Children's Medical Center Legacy in Plano.
Plano was an architectural rendering when I arrived here, and one of the early things that David and John and I talked about was, okay, it's time to make Plano a reality. And not surprisingly, the community of Plano was a little skeptical.
That was a big commitment, financially, to break away kind of from the mothership and not have the one facility. And there's a great discussion among the board of directors about whether or not we ought to do that or not.
You know, he had the insight and looked to the north because a lot of the growth occurred in the north.
His ability to understand the population, to be able to understand healthcare, the demands, what's coming, the needs that are going to be there. I mean, that's what he's good at.
I think about the programs that we have grown, our cancer center, our telehealth and behavioral health, the imprint that we've had on the North Texas area. The growth has just been tremendous.
The launch of the Children's Research Institute at UT Southwestern was a big commitment and I think a bold statement that we were not only concerned about the care we can provide today, but what might be possible tomorrow.
I think about our solid organ transplant program, which didn't exist when I arrived, and today it's thriving. The creation of our foster care program.
Children's health was on the front of the development of clinical care for these children that did not really exist broadly in Dallas or anywhere else that we knew of.
He's always been committed to how can we help these kids, how can we help get treatment, how can we help their parents, how can we help the entire family move on and do better and have productive lives.
The partnership between UT Southwestern and Children's Health, I think, can be seen as two sides of the same coin.
And as a result, you're on the cutting edge of some of the latest technology, latest treatment, and hopefully much better outcomes.
Without the children's and the environment of care for our pediatric patients, we would not be in the position to ensure we were training our future physicians in all of the science and the experience that it will ultimately take for them to be there for their patients.
Dallas is growing and is evolving. It's becoming more diverse, just like our entire world is. But we are paying attention to that. Not every pediatric hospital has a chief health equity officer or an entire department devoted to health equity. So that is where Children's leads the pack.
No matter who you are, if you're a child, you're going to come in, you're going to get the best health care you can.
The leadership role that Chris has demonstrated is not only having that vision, but also keeping the focus of the institution as a whole on the vision of serving children in our community in all aspects of healthcare.
If you take the patient numbers times the number of years he's led this organization, think how many lives he's changed, that he's had a part in making happen.
It's probably millions of children now that have come through here during the time I've had the privilege of this role. It is incredibly humbling. Incredibly humbling.
I think when he first came, we met. I felt that I was in touch with children's all the time, or knew I could be if I needed to be. It was always an environment where I felt very welcome.
You know, he just has a way of making you feel comfortable. You know, anyone that he meets for the first time.
My first interaction with him was an employee recognition event where we were serving meals. And I just said, hi, Mr. Durovich, I am. He said, I know you, Stormy Williams. And I was like, he knows my name? I was just so taken aback. And he thanked me for my work in telemedicine.
You know, at the time we hired him, what we really didn't appreciate that was we were getting 2 for 1. And by that, we were getting Christina as well.
She's way smarter and nicer than I am, and you'll know that instantly. She is the gem of the two of us, and I would not be anywhere close to what we're talking about today without my wife, Christina.
You know, when you say something about children, you say something about Chris. You say something about Christina. And when you say their name, what comes to mind? Children's.
Mr. Durovich, congratulations on receiving this highly esteemed award.
The success that you and your team have had over decades speaks extremely well towards your leadership. So on behalf of the board, a big congrats from us.
I know the award is extremely well deserved, and we really appreciate all that you do and continue to do to serve the needs of children in North Texas.
It has been my pleasure to train at Children's Health and also to work here to push forth the mission. And it feels incredible to know that this mission is not just something that we write down, but it's something that you live and breathe every day. So thank you so much and congratulations.
I had the honor of representing Children's Medical Center Dallas in my district for 3 decades, which is why I am also so proud of Chris's leadership in building and maintaining a diverse workforce that reflects the diverse patient population of our community. Thank you, Chris, for the positive impact you've made on our community and for your work to make life better for children.
Chris, thank you for ensuring quality health care is available for Texas families. Your example has set an incredibly high standard for how the healthcare industry can help make life better for children. Congratulations and keep up the great work.
Chris, it is such a great honor to be here, to be able to tell you congratulations on an amazing run of 20 years, fulfilling your life's passion to make lives better for children at Children's Health. Thank you, is all we can say.